one thing that's like, no matter what treatment you take as far as the insulin itself, you do always have to test your blood sugar to see how high or low your levels are. So blood testing's a consistent thing that you have to do one way or another. I do shots. So I actually have a little thing. So yeah, this is my test kit, test strips, the meter that shows what your blood sugar is, and this is to stab my fingers. I actually keep needles and vials of insulin in here too. So this is just my normal insulin. Now I say normal insulin because I also have a long-acting insulin that I give twice a day. It has like a 12-hour period where the hormones in it just like consistently release the insulin, so you don't, to try to keep your blood sugar steady, because like normal people, their body is like consistently releasing insulin to keep their blood sugar levels steady. But as a diabetic, since, you know, our bodies don't do that, then there's long-acting insulins like Lantus and Levemir, which, like I said, I give twice a day. Some people only give them once a day just to keep it steady throughout the day. If you're on a pump, which is like a little, it's hard to describe. It's like a little thing that you have attached to you. So there's a tube that is put into your body that you leave in there for a 3-day time period. 3 days. You're supposed to only leave it there for 3 days, but most people leave it in there for weeks, honestly, because nobody listens to the government. But if you have one of those, then you have a thing called a basal rate, where the pump just like pushes a little bit of insulin into you every like quarter of an hour. So every 15 minutes, it just drips a little bit of insulin into your body rather than having long-acting insulin. That's how it takes care of it. I was on the pump for a while, so I do know what that's like. It's kind of nice-ish because then you don't have to consistently stab yourself. You just, you know, put in the pump site once I changed it about once a week. And then whenever you need to give a shot, then you just pull up the little, it has like a little, like a meter thing. I don't even know how to describe it. It has a little interface where you can then say, I had this many carbs, and you put in your carb to insulin ratio. So that depends on like how much your body has a tolerance to the insulin or whatever. So a common carb to insulin ratio is you give 1 unit of insulin for every 10 carbs. And so you always put that in when you first get the pump, so it already knows what that is. And so then when you eat, you just say, hey, I had this many carbs, and it automatically does the math to know how much insulin you need. Or if your blood sugar goes high for whatever reason, then you do the same thing. You also have a insulin to blood glucose, I can't talk, ratio. Mine is, I give 1 unit of insulin for every 30 over 120 is what it is. So like as a diabetic, you're supposed to keep your blood glucose within like 80 to 120-ish. And so for every 30 points above 120, I'll give a unit of insulin. And you do the same thing with a pump. You'll put in what your level is, and then like what the how many units it is per number above whatever your target is. And then you'll just put in your blood sugar, and it'll do the math once again for you to figure out how much insulin you need. So those are the main like treatments is either the insulin shots itself or the pump. There's also these things that were released within the last couple of years that are called continuous glucose monitors, which are super, super nice. And they're basically like, it's like a pump, except for instead of pumping insulin into you, it's just a little sensor that you put into your body. And so you'll only test your blood sugar like twice a day to calibrate it. And then the rest of the time it senses where your blood glucose levels are like continuously throughout the day, so that you always know like whether you're going up really high or going down really fast. And that's like something that's a huge lifesaver, because otherwise you just have to kind of like try to sense from your body. If you're feeling gross, then check your blood sugar and see if there's something wrong. So that's like a huge like step towards good treatment as well. And those are like the main treatment things that you have, really, is testing your blood sugar and giving insulin, whether that's through a pump or through insulin, and whether you're testing your blood sugars through the test kit or through the continuous glucose monitor. The other thing is, if you do just use the test kit, you're supposed to check at least 4 times a day. They shoot for it to be like 4 to 7 times a day. So you're like literally constantly stabbing your fingers. So yeah, so that's taking care of your diabetes.